Ladies and gentlemen, thank you for standing by. My name is Daphne Worrell, Marketing Manager for ODG by MCG, and I'm excited to welcome you to today's webinar, Introducing the New ODG by MCG. During this webinar, all participants will be in a listen-only mode. If you'd like to ask a question, please use the chat feature located in the lower corner of your screen. We'll save some time at the end for your questions, and anything we don't get to, we will respond through email following the webinar. This webinar is being recorded, and the recording will be sent to you within 1 week. Our presenter today is Jamie LaPaglia, RN CCM, who is the Implementation Specialist for ODG by MCG. Jamie has close to 20 years of nursing experience, including over 10 years working with some of the largest carriers and TPAs in the workers' comp and disability industries. He is responsible for implementation and integration, helping to integrate and maximize the solutions provided by ODG by MCG, as well as building and managing strategic partnerships with other platform providers. So Jamie, you can take it from here.
Thanks, Daphne. Hi, everyone. Welcome to the ODG by MCG seminar. I hope today is to sort of show you some cool tips and tricks on using our new site, as well as some of the value proposition that we have in making the sort of stuff you do every day a little bit easier to do, and of course, in the end, making our patients better off for it. So with that said, I'm going to go ahead and share my screen. Let me just do that here. Here we go. So you should be able to see my screen. This is the home page for ODG by MCG. I like to kind of break the home page into a few different sections here. At the very top section here, we have what we call the administrative section. The second section here is sort of like a search bar, similar to Google. The third section is a bit of a shortcut section here. You can see a diagram of a human body, some columns of topics and treatments, which we'll go into in a second. And of course, at the very bottom is the shortcut to the state guidelines. So we're going to go into a little bit more depth now. Let's go ahead back to that very first section we have top here. Excuse me. By default, ODG breaks down searches into what we call medical topics. So you'll see when I click on this codes drop down here, you'll see the different types of search that you can do, whether it's by the default medical topics or if you want to search by ICD codes. If you're searching for a treatment, you could use CPT codes, or maybe a medication, you can use NDC codes. We are in various different countries, so if you're in Australia, we also have different Australian codes that you can use. But for today's presentation, we're going to stick to US-based information and US-based data. So we'll go ahead and show the difference between medical topics and ICD codes. So a good example of that is if you scroll down here to the shortcut section, you'll see in the return to work diagnosis here, there's some different names here, different medical topics. And the one I'm going to use right now is broken arm. So for those of you on the call, if you're a clinician, you'll know there really is truly no such thing as a broken arm. Now you may be thinking, of course there's a broken arm. My brother, my sister, my child had a broken arm. But in actuality, a broken arm is a medical topic. It's not a true diagnosis. The actual diagnosis for a broken arm would be more something like say a fractured radius, a fractured ulna, maybe a fractured humerus. So those are all bones in your arm that, of course, can be fractured, hence the term broken arm. So we've broken it down and made it very simple for users to find what they're looking for without having to know perhaps the exact diagnostic term or the diagnosis code. You can still find the information that you're looking for by typing in sort of the layman's term or, again, the medical topic. So that's, again, the search, the generic or sort of default search that you can do in ODG. But, again, if you do want to add ICD codes or specific diagnostic terms, simply just click on the ICD codes that you want to add, whether it be ICD-10 or ICD-9. Then when you type in a search, such as we'll do back sprain here, you'll see that it's going to search for medical topics, such as these ones here. These are all the different medical topics for back sprain. And you also, if you then wanted to search by an ICD code, so I'll do an ICD code now to show you the difference. I'll search by S33.5, which is also a back sprain. When I search by a ICD code, it's going to still show me the medical topics. We'll then add also the ICD codes to the results list. And you can click on any one of these. When you do a search, it's kind of doing 5 searches at once, right? So it's searching within the durations, the treatment, the tau, the formulary, and the cost. Now, you'll notice results in one of those areas because you'll see this little green check mark here, this little circle. So when I do a search for a back sprain, or in this case the S33.5, which is an ICD-10 code for back sprain, it shows me there's results in the durations, the tau, and the cost sections of the site. Again, ICD-10. Another thing that's useful to know is that sometimes when you're looking for something, it's maybe using a diagnosis. Let's say you're looking for a broken finger. but you happen to know that a broken finger is a fractured phalanx. So if you want to search by that more diagnostic term, again, even though it's not the actual code, you're going to still want to check off the ICD-10 box. Because now instead of searching just for medical topics, such as a broken finger, you can actually search for the diagnostic term. So in this case, a fractured phalanx. It will allow me to search for fractured phalanx. So here you go here. So again, just a way if you're struggling trying to find the information you're looking for, sort of a pro tip, if you will, is to remember to click on that ICD-9, ICD-10 box, make sure there's a check mark, and then add that search term there again, and then usually able to find what you're looking for that way as well. So that's breaking down the different codes. In help and training, you'll see if you wanted to on yourself do a little bit more training or you wanted to catch up on maybe a certain section of what we're going over today, click on help and training and then self-paced training. You'll see a self-paced video tutorial going over the entire site from start to finish. You can click on Start Course here, and it'll take you through the whole site, or perhaps you want to just see one section of the site. Well, then just scroll down and click on the area of the site that you want to go over again. Great tool. Other things that help in training are some job aids. So if I go down to information and guides, there's currently one for duration and for treatment. We're in the process of creating one for every tab here, so shortly you'll see one for TAL, for formulary, for cost, and for job profile. Again, that's under information and guides. And these are basically just PDF documents. They're basically job aids that help sort of from start to finish on that particular section of the site, telling you what each function is, what each thing means, and how to use the data within that portion of the site. Okay, last thing in the help and training under information and guides again, you'll have this PT and Chiro guide insert. Really useful information, kind of goes over the conservative treatment approach to treating especially musculoskeletal injuries. I think it's a great thing to look at every 6 months or so. Just give that foundation down, get that basic understanding of using these sort of conservative treatments to improve outcomes. And then also there's the methodology. Now we're not going to go into detail of the methodology, but just to quickly show it to you, it's actually a 119-page document. This really is the foundation of what ODG is. It goes into depth from start to finish, every piece of information within ODG. How do we get that information? How do we rank that information? All that good stuff can be found in this methodology paper. So if you're a bit of a nerd like myself and you'd like to know not just what it is, but how it is, this is what tool or a good resource you want to look at to get that sort of understanding. Very detailed, very in-depth. It kind of also goes into scope of kind of what we do. So you'll see here when we look at the treatment guidelines by themselves, we're looking at almost 300,000 abstracts a year. That's a lot of research that goes into doing what we do. But we need to do that to make sure that your patients get the most appropriate evidence-based care that's out there. So again, almost 300,000 abstracts. From that, we have almost 20,000, 21,000 new articles that we pull, creating almost 8,000 new citations. So again, when you recommend a treatment based on our guidelines, you can be assured that it is the most up-to-date, most appropriate evidence-based medical treatment there is. So that's the sort of administrative section up top. Again, the second part we talked about a little bit already is that search bar. Remember, if you recall, we talked about when you enter a search term, you're doing 5 searches at once. So again, anything you want to find, simply go to the search bar, type it in there. In this case, we'll do carpal tunnel, let's say. And then just pick on the result below the type of section you're looking for. So if you're looking for durations, simply click on the carpal tunnel syndrome below durations. If you're looking for treatments, you can see all the different treatments for carpal tunnel. And then you can see the different sections. If I keep scrolling down, you'll see one for tau and for cost. So here's the tau, and here's the cost. And we'll go over that in just a little bit what those different sections are. But my point right now is just to show you how easy it is to use this search bar, type in a term, type in an ICD code, and find the information that you're looking for. Okay, again, going back to that third section now, as you can see it here, this is the sort of shortcut section I like to call it. And that's because that's exactly what it is. It's a way to quickly get to what you're looking for without having to do a full search for it. Now, you certainly, again, remember with back sprain, I typed it in the search bar here and we clicked on it there, so you can still search for it. This just makes it a little bit quicker. Now, keep in mind, all these terms here can be customized for your company. So, for instance, if your company has a different set of top 15 diagnoses they deal with every day, we can change these diagnoses here and make them customized to what you see every day. So, again, you can just one click, in this case, back sprain, I click on it, opens up the durations tab, and you can see the durations and risk score for a back sprain. You can see how quick that is. And again, I can do that for any of these conditions that are below this return to work diagnosis column. All these, when I click on any one of these, will open up the durations tab and show me those evidence-based disability duration expectations by diagnosis. The third column here is medical treatments. similar approach where it's a shortcut, but instead of showing you durations, it shows you those medical treatment guidelines. These are those evidence-based guidelines to help make appropriate medical necessity determinations. So in this case, let's say carpal tunnel release. I'll go ahead and click on that. It's going to bring me to the treatment tab and show me that treatment or procedure summary for carpal tunnel release surgery. And again, in a little bit, we'll go over the treatments more depth, kind of breaking down the anatomy of a treatment summary, what each portion means, how we use it, and all that good stuff. The goal right now, though, is just to show you how you can quickly use this shortcut section to sort of get to what you're looking for in regards to durations or treatment guidelines. And lastly, that very first sort of section here, if you will, or the first column, if you will, is a picture of a human body. For those of you who use the legacy site, this would be very similar to the chapters, in that each one of these little orange circles represents what we call a node. Now, if I take my mouse and hover over it, you'll see like now it says head. Here it says neck and upper back. Here it says shoulder. Each one corresponds to, again, a chapter, if you will. Again, using that sort of legacy term. But what it does is allows me to see all the treatments that we have for that particular body system. So let's say I had someone with a foot and ankle injury, and I wanted to see all the treatments that were available for someone with a foot or ankle injury. When I simply go down to the node for foot and ankle, click on it, it'll open up the treatment guidelines and show me all the treatments for a foot or ankle injury. As you can see here, there's quite a few. When we go over the treatments in a little bit, I'll show you how to sort of filter these down and really kind of fine-tune and hone in on what you're looking for quickly and easily. The purpose of right now is just to kind of show you how you can quickly use this as a shortcut to sort of find treatments by body system. And then lastly on the home page, all the way down at the bottom here is guidelines by state. Now myself, I used to do utilization review, and I can recall doing UR, you'd kind of be assigned to a state or maybe a region, and you got really good at that state, right? So you kind of knew what the guidelines were, you knew what the state was, you knew the jurisdictional requirements. Well, let's say your coworker was out for a day and you had to fill in for them. Well, then it got a little tricky, right? Because you weren't really sure what that state was. What guidelines did that state have? Did they adopt their own guidelines? If so, how do I get to those guidelines? Well, we provided, again, a bit of a shortcut tool here. If I click on all states here, you'll see it breaks down, it gives you a table and breaks it down in alphabetical order with each state. And it lets you know, does that state have their own guidelines? Have they adopted ODG? And you can see by state, it breaks that down for you. And those states that do have their own guidelines, let's say Colorado, for example. And you can see, let's say I had a Colorado case. I can see Colorado has their own guidelines. Well, if I simply click on the name Colorado, it'll bring me to their treatment guidelines. So it's a sort of one-stop shop. We want to encourage you to use evidence-based medicine. If a state has adopted their own treatment guidelines, we are going to give you a link into their guidelines. If you go to their guidelines and they don't address what you're looking for, you can always defer back to ODG. So again, this table here allows you just to quickly identify if the state has their own guidelines, and if they do, it allows you a way to get to those guidelines quickly and easily. So that's it for the home page. So you can see the home page is really the starting point for all things ODG. It allows you to quickly search, find information, and then apply the information to your case. The next thing we're going to look at is the durations. So again, for an example, we'll just go ahead and click on back sprain. Now, you'll hear me say the term a pinned item or a pinned term. What that means is you'll see this little green box here where it says back sprain. This is a pinned item here. Whatever's pinned to the top here, the data below will automatically update and refresh to reflect that element. So in this case, we have back sprain. So these durations and the risk score is for a back sprain. I can add up to 10 different items up top there. So in this case, I'll add carpal tunnel. I'm going to click on it. And as soon as I click on it, it's going to pin it to the top. And now instead of just back sprain, I have back sprain and carpal tunnel syndrome. And again, you'll see that the A and B values have changed. The durations have changed because now, again, instead of just a back sprain, it's back sprain and carpal tunnel. And the risk score has changed because, again, instead of just back sprain, it's back sprain and carpal tunnel. If you want to remove one of those pinned items, it's super simple. Just simply click on the little X within the pinned topic. In this case, we'll remove carpal tunnel syndrome. It's going to remove it and automatically refresh the data to, again, now just be for a back sprain. Now, in the Durations tab, which we're at now, you'll see the two main components. There's actually several components within the Durations tab, but I think the two most critical pieces are the actual durations. We have here represented as A and B, and the risk score. Starting with the durations, it's important to know how do we come up with these durations. Well, the A value, or the average, represents actual live claim data. We have a little over 5 million claims in our database, and those claims include lost time, work comp and disability, or better yet said, is work comp and non-OC. So these are disability, auto, all those different kind of claims that are not work-related, but nonetheless do involve time away from work. These claims are realized claims. They include all those sort of biopsychosocial issues, all those impacting factors, all those things that keep someone out of work beyond just the medical component. So the average is sort of a real-life example, and it kind of lets you know that if I do nothing different, I can expect this claim to be out this long. That's that average, that A value. Now the difference between the A and the B is the B value is the best practice. This means that it's strictly just a medical component, and it really represents if I treat this patient with the most appropriate evidence-based treatment, I should be able to get them back to work in a base case scenario around the B value, the best practice for the 10 days. I like to kind of refer to B as the recovery time, the ideal recovery time. So when you're managing a case, you're going to benchmark against the A value because, again, that's the current status, knowing that this is current state. This is what I can expect that claim to be in as far as duration. But I'm going to manage towards the B value. I mean, this is the goal. This is the time I want to try to get them back to work within. The difference between the A and the B is the area of opportunity. We want to move away from A and towards B. And the way to do that is to educate, use evidence-based guidelines, and to communicate. Educate meaning we need to understand what they do for a job. We need to educate them and let them know the expectations around return to work, provided it's the duration. Using evidence-based guidelines, we'll go in a second, using those treatment guidelines and finding the most appropriate treatment for that injury or set of injuries. And communicate. We want to make sure we can communicate these to the treatment provider, to the patient, and collaboratively work together to, again, move them from A towards B. So that's the durations, the A and the B. But keep in mind at this level, meaning I just have a back sprain there, I like to call this a diagnosis level duration, meaning I don't have any claim-specific information yet. So while this is a good predictor of outcomes or a good gauge as far as durations, it's not the best predictor. To make it the best, I want to add claim-specific information. And to do that, I'm going to simply click on this little refine button here, and I'll see some additional options open up. I see job class, job title, as well as some other claim-specific information, in addition to these confounding factors. So starting with these sort of claim-specific information, the very first thing is either the job class. If I click down on the drop-down button, I can see the different DOL job classes, sedentary, light, medium, heavy, very heavy, something that most of you are probably very familiar with. But even if you weren't familiar with it, if you just take your mouse and hover over each one, it's going to give you a pop-up and a bit of a definition as to what that job class entails. Better yet, if you have the job title, you can actually type that in the job box here. So I'll go ahead and just type in, I don't know, let's use teacher. I'll type in teacher. It's going to go to our database of a little over 30,000 jobs. It's going to show me all the job titles that have the word teacher in it. In this case, I'll go ahead and just click on the standard teacher. Once I do that, it's going to let me know what that job class is. So for a teacher, it's a light job class. And to kind of give you an idea of what different ones would look like, I'm going to go ahead and put, I don't know, let me do firefighter. How about that? Firefighter, just to show you the difference. Now I'm going to click on firefighter. Whereas teacher was a light job class, a firefighter is a very heavy job class. And you see it automatically changes that for me. In addition to giving me the job class, there's also a new tab all the way to the right over here called Job Profile. When I click on that, again, getting someone back to work, we need to, number one, understand what are the durations we expect for this type of injury. And number two is we need to understand, well, what does return to work mean? What do they do for work? Well, by clicking that job profile, it's going to do just that. It's going to give me the job description. In this case, for a firefighter, it's going to tell me what does a firefighter do. It's also going to give me all the essential job demands for that job. These are all the essential physical demands that this firefighter has to perform to complete their job of injury or their firefighter job. So you can see it breaks it down. It color codes it. Green is least impactful, yellow is moderate, and red is significant, meaning that is a significant portion of their job. It's significantly physically demanding, and therefore it has a big impact based on the type of injury they have. In this case, a firefighter. You can also see by body system. If you wanted to see maybe they had a knee injury, well, if you click on the legs, it'll give you all the essential functions that required for the legs. So you can see it breaks it down. Not only by type of function, but also frequency of that function within an 8-hour work shift, whether it's occasional, frequent, constant, and so on. So this is really important to understand. To get someone back to work, we have to understand what they do for work, right? The other thing to know is this is a standard job description and standard set of definitions or job functions for a firefighter. But you can also customize this, making it very unique to your particular claimant who is a firefighter. So to do that, you simply click on Customize. You can enter your information in here. When you customize it, you can see you can change any one of these physical demands. You can change the actual job description. You can see I can edit each one of these. You can also print this. You can save it as a PDF. And you can share this, of course, with the patient and the treating provider so that they have a good understanding what that patient does for their job so they can make an informed decision whether they can return to work or perhaps need some sort of light duty or modified duties before they can return to full duty. I'm not going to do a lot on this, but just to quickly show you how I can do that, I click Edit on the physical demands. I can edit any one of these. Let's say that kneeling is not a third of the day, but let's say it's actually frequent. I can change it to 2/3 of the day, save it. Let's say that maybe lifting is not only 12 hours a shift, but they have to lift, let's say, 50 pounds. I can add all that into here, and then once I'm done, I'm just going to go ahead and save it, and I'm going to approve it. Then it's ready for me to send to the treating provider. Now, going back to the durations tab, the other major piece, well, let's keep going down this road, if you will. The next thing beyond the job title is the state of injury or the benefit state, if you will, depending where you're at. I'll go ahead and, for this case, put California. Let's say the claimant's age, let's say it's 55. Now, for the date of injury, of course, that's not going to impact durations, but it does help you get a target return to work date. What it's doing is it's taking the date of injury, adding the number of days for best practice, and giving you a target return to work date, something for you to have a goal and something for you to shoot for. In this case, let's put the date of injury as May 1st. When I do that, it's automatically going to give me this target return to work date. For claim type, again, we have a mixture of OC and non-OC claims, or by default, you can include all of them, which I'll go ahead and do that for now. And then some of these confounding factors. So here we go. We're going to add, let's say this person has diabetes. Let's say that they're obese, and let's say that this person has hypertension. What I want to do real quick is just kind of do it this way. I'm going to open up just a back spring, which we started with. If you recall, I think it was 19 and 10 days. Right, here we go, 19 and 10 days. You see it's just a back spring. Same back spring. We didn't add any other conditions to this. But once we added this claim level information, you can see what it does to the durations and the risk score. As you can see, we started with 19 and 10 and a green risk. We're now at 57 and 25 with a high risk score. So the way you manage this claim will be much different than the way you manage that initial claim, even though it's for the exact same condition, a back spring. So this really gives you some actionable information to make some informed decisions, to educate your claimant, to work with a treating provider, set expectations early on in the claim, and pursue that return to work. The other piece of this, though, is understanding what's the likelihood they're going to go back to work on time, what's the likelihood it's going to be a severe or costly claim. Well, that's what we have the risk score for. Now, if I hover over this little risk score, I can see there's 5 levels of risk: extreme, high, cautionary, moderate, and low. The level of risk corresponds with 2 things: magnitude and volatility. Magnitude means what's the potential duration, the A value. The higher the average, the more costly it is, the longer return to work, the more magnitude. The other piece is volatility, and that just says what's the difference between the average and the best practice. The wider the gap between these two, the more volatile a claim is, meaning there's a bigger difference between a bad outcome and a good outcome. When there's a bigger variance between those two, there's more opportunity for us to have a good impact on that claim. So when you see a high risk score, it tells you it's less likely this person is going back to work on time. It's more likely they're going to have some sort of adverse outcome or a very long duration or longer duration. And this is the case that, again, we want to spend more time on, apply more resources to, and really do our best to try to shoot from that average to that best practice. Now, to sort of put this into dollars and cents, I'm going to go ahead and click on the cost tab. We'll come back to the duration tab in a second, but just to kind of show you the dollars that equate to this. At the claim typical, which is that A value, this claim is going to be about a $17,000 claim. The closer I'm able to get this person back towards best practice, the lower the overall cost. So in this case, best practice is a little over $6,000, saying typical is $17,000. That's the potential impact that you can have on this claim. Getting that person back from average to best practice can potentially save you over $11,000 on this one claim alone. This is very useful information, not only for benchmarking, for setting reserves, but also for helping to understand where you want to apply your resources. This has $11,000 potential by assigning a case manager, by using some other resources you may have. This can help tell that story. Why do you need those resources? Well, this is the potential that we can save by applying and getting this person back from the claim typical or the average, again, to that best practice. So going back to that durations tab, part of getting someone back to work is, number one, understanding what is expected duration, which we have here. Number two, what do they do for work, which we recall we use that, put in the title, and then we have the job profile to get the description and the physical demands. And then the last part of that is pursuing the actual release to return to work. And to do that, we have what's called the Return to Work Prescription Form. Now, to get to the form, you can either click on it here in this little dynamic timeline here. And again, this timeline kind of quickly gives you a snapshot of where you are in relationship to these key points, these key dates. So in this case, we're at today, which is day 56, and it tells us we're just before the average, or well beyond the best practice. Let us know we got some work to do on this one, that we're getting close to exceeding the claim average, which again is based on that national benchmark, based on all those claims out there. Their typical return work for those claims is 57 days, and we're just shy of that. So this is a case we want to probably put a little more effort into, or not so much effort that you're already working hard on it, but really put more resources on it, or try to figure out what's going on. Is there some information we're missing? Is there something that's not happening? Is there some sort of barrier to recovery? Work a little closer to that claimant and figure out what's causing that delay to return to work. So going back to that release for return to work description, again, you can click on it in the timeline here, or if you click on print, you can see it's here as well. So I'm going to go ahead and click on it there. It's going to open up some fields, and this I can enter my information. See here, doctor's name. Now the date of injury, and if I had entered a surgery, that would automatically pull in for me. Now in the comments, this is where you can type something to the treating provider, or if you have a macro, you can paste it into there. Otherwise, you can use sort of the ODG recommended language. So we provide some language that you can use for you in that form. In addition, by default, it's going to give the target return to work. Again, this is the best practice. So we're educating the treating provider to know, hey, for this condition, these confounding factors, this is the expected return to work time frame. There's been multiple studies out there that show when you set that expectation early on in the claim, there's a much higher percentage of successful return to work within that time frame, simply by setting the expectation and communicating it to the treating provider and patient. You can also add the average if you wanted to, as well as the scenarios, which we'll go into in a second, which is to kind of show you that you are also able to add those. The other thing you can add is these recommendations for modified duty. You can see them here. Or perhaps if you had a peer review or IME and they gave you some recommendations for restricted duties, you could paste that in here. And if not, again, you can just add what we have here for you. And then lastly is a job description. Again, this is the generic job description for a firefighter. If you're working with an employer that has their own job bank and they have their own job descriptions, simply copy it from there and you can paste it here. When all done, I'll go ahead and click print. What this is going to do is it's going to create this return to work prescription form for you. This is a form that you can then send to the treating provider and share with the patient. This is going to help you pursue that release to return to work. What it does is it says, hey, Dr. Smith, this patient is a firefighter. It's a very heavy demand job. This is the job description. These are the comments that you can have. Here's the target return to work date. Here are some recommendations for return to work as far as modified duty. And then it gives you a place for the doctor or practitioner to sign off for that job. Now, perhaps the physician says, well, you know what? I see what they do, and giving that, I don't really agree with these restrictions. And well, in that case, they can use the next part, which is this job function evaluation form, which really allows them to delineate each function separately and really focus on what the claimant can do, and not so much what they can't do, right? We understand they can't do certain things, so help us understand what they can do. Don't just say they can't work. Instead, say, can they sit 2 hours a day? Can they sit 4 hours a day? Can they sit 6 hours a day? So on and so forth, going over each function, and again, defining within that function, how much of that can they do in a typical 8-hour workday. So it allows the provider to really kind of delineate and define what that is, send it back to you, and it allows you to work with the employer to see if they can accommodate a position that will work within these restrictions and limitations. So a very useful form. In some of our clients that use this, they've seen a 40% improvement in return to work outcomes because, again, it really allows us to find positions that will accommodate the restrictions and limitations to that claimant's individual injury while not exacerbating or re-injuring them while they pursue a return to work. So very useful documents to use is the return to prescription form and the job function evaluation form. Now, going back to the durations tab, the other thing I wanted to show you, we kind of talked about the scenarios just a second, but here they are again. What the scenarios are is this is, again, it's just a back sprain, right? But what kind of back sprain? Is it a mild sprain? Is it a severe sprain? Well, the scenarios, depending on what the condition is, will be very unique to that condition. For instance, if it was carpal tunnel syndrome, actually I'm going to add that right now just to show you carpal tunnel syndrome. So again, simply type it in, click on it, pins it to the top. Now here's the scenarios for carpal tunnel syndrome. You can see there's quite a few more. But again, it just gives you the sort of clinical presentation. In this case, is it being treated conservatively? Is it being treated surgically? If it is surgical, is it endoscopic versus open? Is it dominant versus non-dominant? So what you do is simply just read through the different scenarios and then click on the one that best reflects the claim you're working with. So in this case, let's say someone had an open surgery for their non-dominant arm. Well, I click on that. It's then going to change that best practice value to whatever that scenario number of days is here. In this case, 42 days. So you'll see the best practice changes to 42. So it kind of really refines it based on the very specific scenario that you're working with for your claimant. And if I keep scrolling down a little further, there's also a section for codes related to the topics. In this case, for carpal tunnel and for back sprain, it's going to give me all the associated ICD-10 codes, or if I wanted ICD-9 codes are here. And it's also going to give me some recommendations, again, just like that return to prescription form. It's going to show me the recommendations for modified and regular duty. And then lastly, something we recently added is the PT and Chiro guide. Very high level, but gives you a quick snapshot just to get you going. Hey, listen, if you have carpal tunnel or back sprain, this is the recommended number of sessions for PT and Chiro. So it gives you, again, a place to get started because, again, we know the faster we get that person that treatment that they need, the faster they're going to get better, the better the outcome. Now, the other component to the duration tab is the sort of referential component. We have a few different resources for that, one being Medline Plus. In this case, I have two conditions here. So if I click on the link, Medline Plus, it shows me those two conditions. Let's go ahead and click on carpal tunnel syndrome. It's going to open up the U.S. National Library of Medicine site and show me the link for, sorry guys, I got too many tabs open. 1 second here. Go ahead and click on that again. Oh, it says it blocked my pop-up. Hopefully that doesn't happen to you. For whatever reason, it's blocking the pop-up. I'm in a new network right now, and it's here. Trying to unblock it. Sorry, guys, 1 second. Let me do this. I'll just show you directly because it's not letting me do it. Here it is. So when you click, it's not like my computer doesn't block the pop-ups. When you click on it, it shows you, again, a resource for that condition, in this case, carpal tunnel syndrome. As you see, it's a great resource to use, not only for yourself, but you can also share this with your patients. Gives them great information on the condition, in this case, again, carpal tunnel syndrome. Gives them information on typical symptoms, typical treatments, all that good kind of stuff that is really useful to understand. There's a treatment section so you can understand treatment planning and all different kind of stuff. I think it's really useful. And again, you can share this with your patients. The other thing that we have here beyond the Medline Plus are these sort of animated videos. Again, in this case, there's a few because I have back sprain and carpal tunnel. These videos can also be shared. You just basically send this link to your patient. Either way, if you click on this, you'll see it does a nice job. It gives you a very high-level overview of the condition. I like to joke you're not going to be able to cure cancer or perform brain surgery watching these, but it will give you good information on the topic, sort of give you a better understanding of what's going on, how it's impacting the patient, or if the patient kind of understands what's going on in your body so you can kind of make informed decisions. This all helps us improve outcomes. It's an informed patient is a good patient. They know what's going on. They can help improve it. They can address it. And if something's happening that's not typical, they can bring it up to their provider and sort of address those obstacles and barriers as soon as they approach. So I'm not going to play the whole video, just kind of give you an idea what they look like. When you're done with the video, simply just click on that thumbnail again. You'll see it goes away. Last thing to show you in the duration tab, I'm going to just kind of like, do this file. So let's pretend that this is wherever you document your claim system. Hold on a second. There we go. So this is where I'm documenting my plan of action, right? So I'm in my claim notes. I'm documenting why I looked at ODG, and it's looking like, return to work is in about 2 to 3 months. So I'm going to put here per ODG, return to work in 80 days. Will reach out to Dr. Smith on whatever. I'm just typing in, but 9/17/19. The point is you're documenting a plan based on this information. What you can then do is click on this copy URL and then paste this below your note. Now, when you come back into this note 2 weeks later, 3 weeks later, a month later, rather than starting over again in ODG, simply come to your last note, copy out that URL. Oops, there we go. Paste it in the web browser, and it will bring you right back to where you left off. Everything will be there, from the job title to the job class to the state to the age. It will all be there for you. You don't have to enter it all over again. Let's put this here. Paste. Oops. Sorry, guys. It's taking a little longer because I'm on this webinar thing. It slows things down a little bit, but doesn't like it today. But when you do that, it should come to this site right here, and you will see exactly what you saw when you were there 2 weeks ago, 3 weeks ago, a month ago. It'll be everything that was there then will be there now. So this is really useful if you're digging back into a claim, if you will, or perhaps your supervisor, if you have an audit team, they want to see what you saw and make sure you're keeping with best practices, or really understand how you came up with the plan you came up with. They'll see exactly what you saw when you were in that claim prior. So a very useful tool, again, that's that copy URL feature. So that's it for the durations tab. Let's go next to the cost tab, because we kind of started that already. And just so you guys can see, here it is right here. It finally came up, and you can see exactly how we left it. You can see they're both exactly the same. That's that copy URL feature. Let me just delete that for now. Okay. So for now, let's go back to the cost tab. Again, the cost tab is looking at, in this case now we're at back sprain and carpal tunnel. It's a total is made up of 3 buckets. We have the indemnity, which is the wage replacement piece, the medical, and the sort of other expenses. This is really from 2 resources. The first being the medical and other expenses, these 2 here. This is again from that database of 5 million plus claims. We also have the treatment data for those claims. We're looking at all those billed treatments for these claims, and we're going to break them up into medical specific treatments and instead of any other treatments, any other expenses, such as maybe transportation, translation, legal fees, anything like that. So these 2 buckets are from those billed treatments for those claims. So in this case, we're looking at about $24,000 in medical treatments, specific $2,700 in sort of other expenses. And then the other resource is for the wage loss component. And that's the indemnity piece. This is basically saying if they return to work in the average, you're looking at a little over $19,000 in wage replacement. If we get them back to work within best practice, we're looking at $8,500 in wage replacement. How we're getting that number is if we have the state, it's going to use the average weekly wage for the state, in this case California, as well as all those rules for wage replacement. So there's a waiting period, there's a minimum, there's a maximum, there's a percentage. All that's being considered, and it's multiplying that times the number of days to give you this actual indemnity wage. Now, if you have the claimant's actual average weekly wage, it'll be much more specific. Simply just enter it here where it says average weekly wage. In this case, I'll go ahead and put 2,000. And now it's going to change, and now instead of, you see what it does to the indemnity. This really picked it up a lot more because now we're using the claimant's actual average weekly wage as opposed to an average for the state. This would be the most specific, most accurate when you're predicting costs or trying to evaluate outcomes. Evaluate outcomes meaning, again, if we did nothing different, looking at a $56,000 claim, the closer we get them back to best practice, the more dollars we save. And more important than dollars saved, but the better we did for the patient. The quicker we get them back to work, the quicker we get them back to health, the better the outcome for the patient. The savings is just a sort of secondary gain. We're really concerned with making sure our folks that we take care of get better, get the right treatment, get back to work, because we know that the longer they're out of work, the more negative the outcome. They sort of develop that disability mindset. They buy into that where they're disabled, they can't work, and all the things that go along with that, those suffered relationships, the family issues, the loss of ability to do their hobbies and all the things they enjoy. It really becomes a sort of a negative sequelae of all those negative things that happen the longer they're out of work. So while understanding the cost savings is important, the real benefit here is getting that person back to those pre-injury hobbies, pre-injury things they like to do. That's really what the goal is of this. This just kind of sort of quantifies it for us. So that's the cost tab. Again, you can also print this. You can copy the URL. So again, if you copy the URL, it'll bring me right back to this tab with this average weekly wage. Everything I've entered here will be in there. With that, let's go now to the TAU index. So I'll click right here, TAU index. Now, the TAU index, I'm going to just put backspring again, just so it shows a little easier. But you could have more than one thing there. Again, it's going to that database of 5 million plus claims and looking at all the bill treatments for it. And it's going to break it into a table for you. And it's going to sort it by frequency from most frequently performed to least frequently performed. So again, for those claims that we have in our database for back sprains, these are all the different treatments that were ever billed for it. Again, you can look at the frequency from most frequent all the way down to least frequent. So it kind of helps you understand standards of care. What is being done for these types of claims? What kind of treatment should they expect to see? And so on. Then what it's doing is it's adding this payment flag. And the payment flag just says, is this treatment appropriate or is it not appropriate? If it is appropriate, it'll have a green and yellow payment flag. If it's not appropriate, it'll have a red or black payment flag. Now keep in mind, not appropriate doesn't mean you don't do it. It just means, hey, if you have a red or black treatment, you probably want someone to look at it first. You need someone to review it, especially the red ones. The red ones could be potentially done, but there needs to be some clear rationale why you want to do those treatments when, again, they're not supported by evidence-based medicine. So that's the difference. The green and yellow is supported. The red and black is not supported. The difference between the green and yellow is green means there is evidence-based medicine to support it, whereas yellow is there really isn't. The reason for that is there is some treatments out there that just don't have the research that we're looking for. There's no random controlled trials for ice packs. Nonetheless, we know it's done very frequently, it's relatively low cost, and therefore for someone with a back sprain, we want them to have those ice packs as quickly as possible because again, they're done frequently, they're low cost, and they correspond with good outcomes. So we want them to have those types of treatments. Green, same thing. Green, the benefit is we also have evidence-based to support it though. So again, brings us to the next thing, which is off-visit number. This tool was initially called the Your Advisor in the legacy site, and the Your Advisor was a way to auto-approve. So quality care quickly. Again, if it's appropriate, we want them to have that treatment as quickly as possible. We don't want to hold it up in review. Even 3, 5, 7 days that we're holding it up, those are 3, 5, 7 days that we could already give them treatment. They could already start getting better and moving them closer to getting back to work. So that's what this tool is really was originally developed for, is to allow you to sort of auto-approve certain treatments, or also understand what treatments from a sort of claim or diagnosis level would be more appropriate. Green and yellow is appropriate, red and black less appropriate, or not appropriate, I should say. If you click on and expand any one of these lines, it'll give you some more information as far as how frequently you can see this type of treatment for this diagnosis, in this case a back sprain, breaking it down by quartiles, so 25th, 50th, 75th, and so on. The average number of visits for this type of treatment, the average cost, and then the cost per visit. So this is also helpful for UR folks who are trying to get a cost per code. If you come here and look for the cost per visit, this is the cost per one of these CPT codes. So it's a good way to capture averted medical expenses and so on. The other thing in the TAU index is this very last column. This is new to the new site, this ODG by MCG site. The legacy site did not have this. This is called the TAU index. Now, if I take my mouse and hover over it, it gives me a little blurb on it. It tells me what it is. The TAU index really measures outcomes, and outcomes really mean return to work. And it's a score from anywhere from negative 100 to positive 100. A positive score means there's a positive outcome. It means someone did go back to work on time. A negative score or a negative number means there was a negative outcome, which just means they did not go back to work on time. So what we're really trying to do is, like this TAU really stands for treatment, analyzer, and outcome. And that's what it's doing. It's analyzing the treatment and looking at the corresponding outcomes. Now, we can't say it caused the outcome. We can say it correlates to the outcome, which means that for someone with a back sprain, they had this, say, this office visit or this therapeutic procedure, which is a PT code, it corresponded with a good outcome, which means they tend to return to work on time. So we want to sort of encourage those types of treatments that correspond with good outcomes or have a positive TAU index score, as opposed to those ones that have a negative score. So let's say like this one here, this outpatient service or nerve conduction study. Well, for a back sprain, those back sprain claims that have this CPT done did not return to work on time. They had a bad outcome. That kind of helps you gauge not only from your perspective, but also from a case management perspective. If you're a case manager and you come into a claim 6 weeks, 8 weeks into the claim, what I recommend you doing is first coming to the TAU index, plugging in those treatments to the TAU, and like for instance, either by name or by code, and looking at it. Are they more green and yellow, or are they more red and black? If you come into a claim 6 weeks in and you run, say, 10 treatments through the TAU and they're all red and black, we'll kind of let you know, hey, this person's not really on a good treatment approach. We might want to work with a treatment provider to see if we can, is there something we're missing? Or do we just need to re-educate and see if we can get them on a better treatment approach? Because we know if we don't, they're likely not going to have a great outcome. If they're getting red and black treatments or negative TAU score treatments, history tells us they're not going to have a good outcome. Or as opposed to if we come in 6 weeks in and we run all the treatments through and they're all green and yellow, or they all have positive TAU index scores, well, then we want to probably take a more back-end approach, meaning we don't want to be as aggressive with those because they're already on a good treatment approach. They're already being treated appropriately or with the most appropriate evidence-based modalities. So really understanding what the TAU tells you can help direct the intervention level, whether it's more aggressive or maybe a little bit more laid back, depending, again, on the type of treatment they've received today. So that's the CPT, that's the TAU index. Next, let's go to the treatment tab. Now, the treatment tab is just that. It's looking for treatments and helping us understand, are these treatments medically necessary based on the evidence-based guidelines or not? And if they are medically necessary, some will be, well, they're medically necessary in certain situations, hence conditionally recommended. So there's actually different levels. There's recommended, conditionally recommended, not recommended, and under study. Recommended and conditionally recommended are together. The only difference really being is conditionally recommended needs certain criteria to be met for it to be recommended, whereas recommended is pretty much recommended no matter what. Although I will say typically most everything's kind of conditionally recommended, right? So there is, even if you think even like acetaminophen, well, if you have kidney issues, you may not want acetaminophen. So my point is everything kind of has a caveat, but in general it gives you a good understanding of when something is medically necessary as opposed to when it's less than medically necessary, we'll need a review. So in this case I have back sprain here. It's giving me all the treatments for someone with a low back injury. So you can see all the different treatments here. That's the sort of default. The other thing you could do is, again, do a search by using that search bar. In this case, let me just type in MRI. It's going to show me all the treatments that have the word MRI in it. These are all the different types of MRIs that are in our treatment guideline. But let's say I don't want to look through all these different ones. I just want to see MRI for the low back. Well, no problem. I have MRI here. I can either type MRI low back or just keep MRI and use my filters here. You can see there's 3 different types of filters. So in the body part, I'm just going to click on low back. And now you can see right there, there's the MRI for the low back. That's how quick it is. Just type the name and or use your filters, and it's that quick. The other 2 filters, the first one's by recommendation type, recommended, not recommended, under study. And the last filter is category. You can see the different types of categories of treatments we have here. So maybe you didn't have an exact treatment, but let's say you had a patient with a neck injury, and you really didn't know what the pain generator was yet. You know they have this neck pain, they tried some physical therapy, they continue to have that pain, so you really need to, the next step is to sort of get a diagnostic study done to really help understand what's causing this pain, what's the pain generator. Well, in that case, I'm just going to go ahead and click the wrong thing, sorry, go back to treatment here, click here. In the treatment tab, I'm going to use my filters, right? So under recommendation, again, I want to know what are the recommended diagnostic studies for someone with a neck injury. So recommendation type, I'm going to put recommended. For category, I'm going to do diagnostic. And for body system, I'm going to do neck. Now I can see all the different types of recommended diagnostic studies for someone with a neck injury. This kind of helps me get a treatment plan approach. Helps me understand what are the appropriate diagnostic studies. I can then work with the patient, work with the treatment provider, say, hey, did you ever consider a CT or an MRI? Now, if it's conditionally recommended, like an MRI, you might want to look at that guideline first, though, so I'll go ahead and open that one. It tells me these are when it's recommended. One of these criteria are met. You can see some of them are recommended, but they also say CT preferred. So in that case, when you work with the treatment provider, you say, hey, have you considered doing a CT? So that's how you can use your filters to really fine-tune or really find the type of treatment you're looking for. But from a more sort of holistic approach, where you just want to kind of understand what a good treatment plan would be, below the filters, there's this treatment planning section here. And it's by body system. You can see a lot of different body systems here. I'm going to go ahead and show you the one for low back. So I click on that. Now with a low back treatment, the first thing you really want to understand, is there a radicular component, yes or no? And that's because low back injuries kind of fall into 3 buckets. We have our soft tissue injuries, which are like a back sprain strain injury. We have our sort of injuries that result in some sort of nerve impingement. That's like a herniated disc or something. It's something that's impinging the nerve or causing pressure on the nerve. And then you have sort of your degenerative process, like your visceral arthropathy or your degenerative disc disease, anything that's really degenerative or sort of progressive in nature. So really those kind of fall into 2 main treatment approaches. And that really is defined by the presence or absence of radicular pain. Well, what is radicular pain? Well, no, you don't have to know that, because if you come to the treatment plan, it kind of tells you, identify radicular signs. And it tells you these are what you should see to identify is there or is there not a radicular component. Once you've identified that, you just follow that treatment plan. No radiculopathy, here's the first visit, second visit, third visit, so on. If there is radiculopathy, then you follow that treatment plan. Same thing, first visit, second visit, third visit, and so on. In medicine, when we're trained in medicine, we always learn what normal is. That when something stands out, when it's abnormal, we can sort of quickly identify it. Same thing is approach here. You don't have to follow this treatment plan. This is not written in stone. It's not a cookbook. It's not a rule book. What it does do is kind of gives you a typical, appropriate approach. It's an evidence-based approach to treating these types of injuries. That when you see something that doesn't fall into this approach, doesn't mean it's wrong, but it should stand out. So that you can sort of pay more attention to it and then really understand, is it really appropriate, or do we need to do some more work here? Do we need to do a peer review? Do we need to do an IME? Do we need to reach out to the treatment provider and understand why they're doing this as opposed to something within the normal or typical treatment plan? So just to understand, the goal of this is to understand that this is not necessarily written in stone, that you don't have to always follow this, but it's a good guide. So when you see something that falls outside of the guide, it makes you look at it a little bit closer to really understand, is it really appropriate or not? One more thing on the treatment. Just to break down, I'll use one that has a lot of information. We'll use spinal fusion. There we go. Kind of show you every treatment summary or procedure summary has the same core components, that being the treatment name, the corresponding body system, the treatment type, and the recommendation statement. Now, in addition to that, some will also have these related topics, the ODG patient selection criteria. Anytime you see this blue box, I always recommend highly looking at that. It usually has some very critical information of when to see, what should be seen in order to support that particular treatment is medically necessary or not, or things you shouldn't see, that kind of thing. In addition, for surgeries, a lot of times you'll also see the hospital length of stay and the post-op physical therapy. Some will also have this sort of, I don't know what you call it, red box, but this risk versus benefit box. If you're a case manager, I highly, highly, highly recommend you looking at this and educating your claimants on this information so they can make an informed decision. This information is very critical to that. And then there's the evidence summary. So again, going back to those 300,000 abstracts, those 21,000 articles. This is that research. This is the thousands and thousands of hours of research that go into making sure that you have the most up-to-date treatment guidelines and treatment guidance. And if you look on the bottom right-hand corner, it tells you when this particular guideline was last reviewed and updated. In this case, this one was April 9th, 2019. We really take pride in making sure that we update these frequently so that you have the most up-to-date information and can make those kind of decisions. If you wanted, again, in the summary, it gives you just that summary of all the research that was done. If you wanted to look at any one of these different, one of the different articles that were used, the research studies that were used, you can click on any one of these. It'll give you the reference, the citation, the ranking, and a link out to PubMed ID. I'm sorry, the PubMed ID that links you out to the clearinghouse, which again gives you the abstract article of that research. It allows you to also see what was looked at. Click here. And then last thing we'll show today is the formulary. Now the formulary is sort of an extension of the treatment guidelines. Many of the drugs in the formulary have their own treatment guidelines, but the formulary makes it sort of easy and quick to really understand yes or no. And I shouldn't say not yes or no, but why, meaning yes, safe and effective is the first line option, supported by the guidelines, and meaning needs review. Not no, but needs review. Right? So no, N doesn't mean you can't ever use that medication. It just means, hey, listen, there is a first line option available, hence the Y. So if you have an N, we need someone to look at that and try to understand why they're using that one as opposed to a Y drug. So breaks it by class. That first column is all the classes. You can see it's alphabetically listed. If you want to see just a particular class, just click on the drop down and pull out the class you want to look at. The next column is a generic name. Then we have the innovator brand. The note, which I'll skip for a second. Generic equivalent, just like it sounds. Is there generic available? Yes or no. The status, again, that's that Y and N. This is really the foundation of the formulary. Y, yes, safe and effective, N, needs review. Cost, just a very generic cost. This kind of just helps you for benchmarking. Not necessarily the exact cost you're going to pay, but just kind of gives you an idea of impact for that medication. Now, going back to that note, there's several drugs that can be used for more than one indication. Good example is Wellbutrin. So I'll look to the note. So for mental disorders, it's a Y drug. For pain treatment, it's an N drug. One more, I'll do Suboxone. Oops, like it's not right. Suboxone. There we go. For detox, it's a Y drug. For pain treatment, it's an N drug. If you click on any one of these, just real quick, gabapentin, it's going to expand it for you. It's going to show you all the corresponding treatment guidelines that go along with it. It's going to show you every NDC code that's within that entry. And it's going to also give you a MedLink Plus link, so you can get information on that particular drug, why it's prescribed, side effects, all that good kind of stuff. Again, these are things you can share with your patient. And then lastly, last thing for today, is the opioid MED calculator. MED stands for morphine equivalent dose. And remember, this kind of lets us compare apples to apples, meaning we're going to convert every opioid to its morphine dose so we can sort of compare them together and understand the corresponding risk. So even if you're not a clinician, it's still great to use this tool because it allows us to understand the risk associated with the amount of opioids someone is taking. So in this instance, let's say that someone's taking 30 milligrams of hydrocodone. That's 30 MEDs. Let's say they're taking 45 milligrams of oxycodone. That's what? Let me do 30 again. There we go. That's 45 MEDs. So it's going to take the daily dose of that particular medication, convert to MEDs, and then do the total daily MED. In this case, for these two medications, it's 75 MEDs a day. When I look at this little graph here, that tells me that claimant is at extreme risk. When you see someone that's at extreme risk, that tells you, hey, they're likely not going back to work anytime soon. So I may want to refer this to a clinician. I may want to refer this to a peer, an IME or something, because we know that if they're taking this dose, it's likely they're going to have some sort of adverse outcome, and it's very unlikely they're going to return to work anytime soon. Last thing to show you in the MED calculator, let's say you don't know what the drug is. Let's say you have Zohydro, and you weren't sure what is Zohydro. Well, just type in either the NDC or the actual drug name here. And again, just type in the daily dose. It will still convert it for you. So that is it. Daphne, do we have any questions?
Hi, Jamie. Thank you so much. Actually, we haven't had anyone. Oh, here, we just got one. How does licensing work, and how much does it cost?
So that's a great question. So licensing for this ODG by MCG site is actually done on an enterprise level. I'm not in sales. I can't say what things cost. They don't trust me with the money. But I can tell you that essentially what it does is it looks at your organization size, so how many claim adjusters, how many case managers, and then they give you a price based on that number. So it's not necessarily number of users. It's really based on the number of folks you have working in your organization. That's how they come up with the cost.
All right, great. And if you can kick it back to my screen or move the slide over, we can get our contact info up there. Here we go. Let's see. And we do have one more question. Can we customize the data within the ODG by MCG platform?
Absolutely. Pretty much everything you see that I went through today is all customizable. So you would work with someone like myself. I'm an integration specialist. What I do is I work with you and your leadership team. We can work on a plan to figure out what you want customized and also integrate so that not only you have to pivot out to our website, but a lot of the information you saw today we can pull into your own website. So you're not having to go somewhere else. The information is available to you at your fingertips in a system you work within every day, which is really the goal, right? We want to make it as simple and easy for you to get that information so you can affect a good outcome.
All right. Well, thanks a lot, Jamie. Thank you for the informative presentation. Thank you, everyone, for attending. And this recording will be sent to you within 1 week. And you can always email us for questions at odghelp@mcg.com. Thanks a lot.
Thank you. Bye, everybody. Have a good rest of the day.